Thanks a lot for having me. My name's Angkustsiri. I'm a fellow in developmental pediatrics here at the Mind Institute. And I've had the honor and pleasure of meeting the children and families that have come to participate in our studies here. And I've learned a lot from those experiences, and I wanted to be able to share them with you and hopefully provide some information that'll be useful for both parents and pediatricians, doctors, in dealing with chromosome 22q11 deletion syndrome. Okay, as Tony alluded to earlier, there are all these different names that can be quite confusing with the terminology. And so for that reason, we do prefer the terminology 22q11.2 DS for deletion syndrome down here. And we've already discussed the reasons why there's a broad spectrum of involvement in a lot of the organ systems that are involved, and not everyone has every system. And this is just an easier way to keep track of what we're talking about, so we all know we're talking about the same thing. Okay, so let's talk chromosomes here. So 22q11, so Q just means the long arm. So here we go as far as our 46 chromosomes that we have. There are 23 pairs. And here is chromosome 22, 2 pairs that each individual has. P for short arm and Q for long arm. So when there's a deletion on the long arm, then that individual will just have 1 copy of that chromosome on that area. And the test that's used now to diagnose 22q is called FISH. It stands for fluorescence in situ hybridization. And simply what they do in that procedure is they use fluorescent probes that bind to different areas, in this case specifically chromosome 22. And based on what lights up, you're able to tell if there's an area missing or not. So in this top slide here, we have 2 copies of both long and short arm. And down here, in an individual with the deletion, you see here there's only 1 copy of the long arm and 2 copies of the short. And this test here detects about 95% of individuals with the syndrome. Okay, a little bit more. So the estimated incidence is about 1 in 4,000 live births. This is actually the most common microdeletion syndrome. And this number may actually even be an underestimate, given that the techniques we're using now to detect the deletion kind of depends on the presence of heart problems and how individuals that are picked up earlier on in life are usually identified. Most of the time, the deletion is a de novo or a new mutation that was not passed along from parent to child. So that's an important thing to know about. It is autosomal dominant, meaning that an individual with the mutation has a 50% chance of passing that deletion on to his or her offspring. There is a large spectrum of involvement. Many different organ systems can be affected, including the heart and cardiovascular system, the face and palate and mouth area, the immune system, developmental concerns, as well as many others. And I just put this picture up here to kind of give a little bit of orientation about areas in development that are going on during embryogenesis. So in this area here, we have what's called the pharyngeal pouches that come together and ultimately lead to the structures in this area of the face and neck and around the chest area. That helps give us a little bit of more insight into when these different systems are being involved. So, for instance, when we go into the details of cleft palates or facial differences, you can see that that's coming from these same areas, as well as the immune system being involved with the thymus and other kind of neck structures here. Okay, so we're not going to go through all 185 features here. This is just to kind of hit home the illustration that there is a wide spectrum that can be involved. And many individuals can have some, many, or all of these. And so we have to keep that in mind, that every individual is different. So the topics we're going to cover are not all of those, but generally kind of the more common or the more serious issues that have come up in consultation questions that parents have had concerns about and want to know more about. And so we're going to try to go through these one by one. The first areas we're going to talk about is the heart and the cardiovascular system. And most individuals that are picked up earlier on in life are usually because of structural heart disease that is identified usually in the newborn period or in the first year. And so 75% of children with the deletion have some sort of difference here in either the anatomy of the heart or the vessels that are involved. Tetralogy of Fallot is common, and what that is if the heart is here, and this is the aorta, the vessel that leads out, in tetralogy of Fallot, there's a difficulty with how the heart is communicating to the aorta here, as well as communication between the two sides of the heart. That's often a defect that requires surgery and can be quite severe. A VSD, ventricular septal defect, involves communication or a hole in the septum or the wall that separates the two chambers of the heart. That can also be seen. Pulmonary stenosis involves narrowing of the vessels that communicate between the heart and the lungs. Other difficulties can be vessel anomalies, so the arch here of the aorta can be kind of interrupted or narrowed in certain areas. There can be vascular rings where there are connections between vessels in different areas that aren't usually there, as well as different anatomy of the vessels that come up into the neck area to the head and supply other parts of the body. So given the high rate of difficulties with the heart and cardiovascular system, we recommend that children on diagnosis have a cardiac evaluation, which includes an echocardiogram, that's a sonogram or ultrasound of the heart to the anatomy, and an EKG to look at the conduction system. Another commonly affected organ system involves the ear, nose, and throat area. So many children are often identified because of cleft palates or VPI, which is velopharyngeal incompetence or insufficiency. This is also, between the two of these, that's very common, 75%. And so these can present with problems like feeding difficulties or nasal regurgitation. When children vomit, the liquid comes up out of the nose instead of out of the mouth. That's a common occurrence that parents have noticed. And as far as having a cleft palate, there can be an overt cleft of the lip that you can see from the outside, or even of the palate that you can see here. If this is the bone that makes up the palate, here's your tongue. But in addition, there can also be more subtle clefts of just maybe the bone covered by some skin that you wouldn't necessarily see on first appearance. So you can have something called a submucous cleft, where there is skin overlying the defect in the palate. And oftentimes a sign of this is a bifid uvula. This usually looks like a little punching bag in the back of the throat here, and when there's a little bit of a cleft here that makes two pieces, it's called bifid, and that's an important sign. A little bit more about VPI. So the muscles that are involved in the back of the palate here, in the back of the mouth, that are important for feeding as well as for speech and articulation, those muscles can be weak and can lead to a lot of the difficulties that we see here. Sometimes hypernasal speech is also common. And so for some of these more subtle difficulties, or if there's VPI or weakness in those muscles, that may not be able to be identified just by looking from the outside. So endoscopy, or bringing a camera in through the nose area, done by a specialist, an ear, nose, and throat specialist, can identify if there's difficulties in how the muscles are functioning, or if there's a more subtle cleft. Ear infections are also common, and many children need tubes put in the ears. Conductive hearing loss, which is due to fluid in the ears, can be common, 45%, which can get better when the fluid is dissolved. And a much smaller percentage have problems with the nerves in their hearing, sensory neural hearing loss, right here at 10%. Vocal cord paralysis or laryngeal web, where your larynx and the windpipe area may be narrowed due to some of these abnormal connections we had talked about earlier in the vessels, that can also occur. So for our recommendations, we do recommend that an ear, nose, and throat specialist evaluate the oropharynx area with endoscopy. Routine hearing screens are very important. These are, during the early years, are the important years of obtaining and developing language. And then also a neck MRI if there are going to be any surgical procedures in the neck area for tonsillectomies or for heart problems. It's very important to know if those vessels aren't where we expect them to be. Okay, moving on to the immune system. So this occurs less frequently. We see here 25 to 30% of the time. And the immune system has two branches, your T cells and your B cells that help. So your T cells help fight off your infections by those cells themselves, whereas the B cells produce antibodies that help protect yourself as well. And generally speaking, what's more common is problems with the T cells, where the number of T cells may be decreased and lower. However, looking at function, usually the cells that are there the function is impaired just mildly, and sometimes there's even normal function. And this is related to the thymus, which is the gland that sits right here in the chest that produces those T cells. Antibody production is usually okay, although there are some rare occurrences of deficiencies. And usually earlier on in life, there are more problems with the immune system. It seems to recover as children get older a bit. And so some of the infections that are commonly seen are recurrent ear infections, sinusitis, bronchitis, or pneumonias. Our recommendations include checking T and B cell counts, antibody levels, and other tests for how the immune system is functioning. It's important to know what a child's immune status is before giving live vaccines. That's usually done at about 1 year of age. And for surgeries or big procedures where blood transfusions are going to be involved, there are special precautions that can be taken. In addition, it may be helpful to check to make sure that children have responded to their vaccines appropriately as well. Another system that we look at carefully is the endocrine or hormone system. And so there can be difficulties with low calcium levels, hypocalcemia, which can cause symptoms such as seizures or muscle cramping, irritability. And that is usually related to low levels of your parathyroid hormone. These are these little hormone, little glands that sit right on top of the thyroid gland. And that can be low in as many as 25% of children. Thyroid levels can also be low that respond well to hormone therapy. In addition, children with 22q tend to have short stature and are on the smaller side. However, there can also be additional problems with growth where they may actually be deficient in growth hormone. So it's important in every visit, as all of your pediatricians are doing, is following height and weight and head circumference. But if growth is particularly low, we say less than the third percentile, it would make sense to probably see a specialist, an endocrinologist, about evaluation for growth hormone deficiency. Okay, moving on to autoimmune disorders. And as we're going further and further along the list, I should mention that, not everyone has every one of these areas involved, but it's important for us to know about in case something happens and comes up. And usually there will be symptoms in order to lead you towards thinking that way. Some of these, autoimmune diseases are diseases where your body ends up attacking itself, and it may be seen in different conditions such as, type 1 diabetes is a type like that. For children with 22q, the literature has shown a bit of an increase, although these are still rare conditions, of autoimmune disorders in the blood, so affecting platelets, the cells that help you stop bleeding and make blood clots. And there are many different kinds of disorders related to that called ITP, idiothrombocytopenic purpura, or von Willebrand's disease, or Bernard-Soulier. White blood cells can also be attacked, and anything affecting the blood in that way where the counts are low are called cytopenias. Juvenile rheumatoid arthritis has also been identified about 20 times more commonly in children who have 22q. Again, it's still a rare disorder, but it is more common. IgA deficiency, which is an immunoglobulin or antibody deficiency. Raynaud's phenomenon is a condition where some of the circulation may be a little different. You may see kind of blotchiness in the hands. Sometimes it's painful. There's also been some reports in the literature of cases of cancer or liver cancers like hepatoblastoma, but these are just been isolated rare conditions, but something important to look out for.
Excuse me, would you mind, can you tell us briefly
Yes.
the age that you would see these emerge?
So it could be, a lot of the platelet problems actually they can occur at any age, but more generally, a lot of the lower blood platelets are more in the teen years, the earlier teen years, but we recommend kind of yearly surveillance, just checking for it every year. I'm sorry?
Blood test?
It's a blood test, yeah. It's a routine blood test. Kidney problems are common. Usually they're structural without any consequence as far as the kidneys are working fine, but you may see differences such as small kidneys or extra tubes in the kidneys or differences in the renal system. So a renal ultrasound can show you any of those problems. Musculoskeletal complaints are also common. So cervical spine anomalies can be seen, such as differences, fusion or differences in the vertebrae in the neck area, so the bones in the neck. And those are important to know about because if they're unstable, sometimes that can affect the spinal cord in those areas. So certain precautions would be taken. Flat feet is also commonly seen. There can be chronic leg pain related to a lot of flat feet and hypotonia or low muscle tone that often physical therapy can help with, or sometimes orthotics or inserts can help alleviate the pains. Low muscle tone is very common early on. Polydactyly, so extra toes or fingers are sometimes seen, and craniosynostosis, which is premature fusion of the sutures, which is the space between the bones and the skull. We recommend checking the neck area with an x-ray after age 4, because at that time there's enough minerals and calciums in the bone to be able to see the bones adequately. Okay, eye problems. It's also important to make sure that there are yearly eye exams done by an ophthalmologist, someone who can dilate the eyes and also see the back, the retina of the eyes, because sometimes these vessels can be a little different as well. Lazy eye or strabismus has been reported, as well as ptosis, or kind of a weakening of the upper eyelid muscles. There is kind of a characteristic look to the eyelids that will show coming up in one of the next slides, and that doesn't have any functional consequences. The GI system also can be involved, including constipation, reflux, hernias, malrotation. Less commonly, that's just when an area of the intestines twists on itself. And so some characteristic features here that can help people identify children who have the syndrome that haven't been identified. Asymmetric faces, so sometimes in a smile or when a child's crying, one side may not lift as much as the other side. Sometimes what's called puffy or hooded eyelids. There may be a wide space between the eyes, which is described as hypertelorism. A broad nasal bridge. The nose may have a characteristic appearance that may be described as kind of bulbous at the bottom or tubular. A short philtrum, which is the space between the nose and the lips here. Ears may also be kind of small, or they maybe have a folding pattern to it that you can see here. Developmental delays and some developmental behavioral concerns. Those are common as well, including delays in motor skills. A lot of that may be related to hypotonia and weak muscles. Speech and language delays, including expressive language and social use of language. Pragmatics is what that's called. Learning disabilities. So in looking at full-scale IQ, the reports from the literature are that there's low, average to borderline range on IQ testing. However, this can be very misleading because if you break apart looking at your verbal IQ compared to performance IQ, there is a characteristic pattern where the verbal IQ is usually higher than the performance IQ. And that's important for targeting educational programs, IEPs, and making sure that intervention is individualized and appropriate. Difficulties with planning, math, and visual spatial tasks as well. Behavioral concerns. Ingrid and Joel will be talking about some of these other conditions that are commonly seen. Attention deficit hyperactivity disorder, either the impulsive type, which is more kind of hyperactive, or more of the easily distracted or inattentive type. This is common. 30 to 50% of children may have difficulties and can respond well to interventions, both behavioral and medical. Screening for psychiatric problems is also important. Those will be addressed later as well as screening for autism and autism spectrum disorders. So resources. It's really important to try to get what you can going early. So early intervention services, including speech therapy, occupational therapy if appropriate, or physical therapy, as well as social skills can really make a big difference. Upon entering the school system at age 3, the IEP, the Individualized Education Plan, is very important, and most children usually qualify under one of these diagnoses, including other health impairment, specific learning disability, or speech and language impairment. A 504 plan can be put in place if an IEP isn't already in place, where there can be accommodations made in the mainstream classroom that a child's participating in to help if, for example, fine motor difficulties were a problem, being able to use assistive technology or scribe, or other accommodations like more time for tests and things that can help someone function and get by a little better. Okay, so in summary of everything that we kind of just talked about here, I broke down the recommendations that we have for different times. At diagnosis, or at least once, depending on the evaluation, a child should have an echocardiogram looking at the heart, immune function testing, and this may have to happen more frequently if anything is found. An ear, nose, and throat evaluation, looking at the muscles in the back of the throat, as well as clefts. Cervical spine films once the children are old enough. Renal ultrasound, and of course genetic counseling. Yearly, it's important to follow eye exams, hearing exams, the blood test that we talked about, so a CBC, a complete blood count, that shows us the red blood cells, it shows us the white blood cells and the platelets. Calcium is important to follow as well, that can be followed in the blood, and thyroid hormone. Dental care is important, and so is routine dental visits. And then as needed, depending on the particular cases, there may be other referrals or specialists that should be consulted. So as needed, a craniofacial panel or a cleft palate team, a better look at the vessels in the neck and chest area, endocrinology for hormones, immunologist if the immune system is low. Sometimes anyone with bleeding problems may need to see a hematologist. Rheumatology for joint problems or concerns about autoimmune diseases. And orthopedics, gastroenterology, as well as neurology if needed. Again, developmental pediatrician or child psychiatry can be helpful in managing a lot of the behavioral and mental health issues. And school involvement is very important if it's a daily activity. So here are some resources and websites. Here's the CAVIL website up top that'll have this talk on there, as well as other resources. There are some books that parents have found helpful as far as dealing with IEP services and special education needs. This is Educating Children with Velocardiofacial Syndrome, and then Missing Genetic Pieces, Strategies for Living with VCSF. Here's contact information. I'm happy to talk with anyone when we have some time during the break, or if you have questions that come up later, email is a great way also to communicate. And there are some references as well that if you wanted to look up anything that has been talked about during the presentation. So thank you for your attention. I hope this was useful and helpful. And I'm going to move on. Yeah.